So we're gonna. Ready? Okay. We're gonna open the hearing. On. For budget. Take it from here, or what do we do now?
So this is just for the opportunity for the public to come and weigh in on what they would like us to see working on. So we don't actually present. It's just a open comment session for them to be able to provide input.
Okay.
So we will sit around for 30 minutes, and if somebody shows up, we'll listen and we'll take notes, and then we will take it from there.
And Claire, do we have anybody on public comment over there?
Lindsay.
Yeah. Okay. Okay. The hearing is open.
This is a requirement of
Yeah.
Department of Health Services. This is why it's the only committee, I believe, that does it. So it's one of our requirements to check the box to get the funding.
And do we do this every budget year?
Yes.
And do we ever get comments
I haven't seen any yet.
over the years?
Over the years.
Should have brought some donuts.
Yeah.
Yeah, don't you think?
They
will come. Some donuts.
And how do we market it or how do we help
It's
people?
listed,
Sure, it's
so
somewhere.
when the clerk puts out the agenda notice, it is listed, it's on the website. We used to have to do an affidavit with the newspaper to say that we actually did that, but the state has now dropped that requirement. People might not know what that means. Yeah, so we had to prove to the states that we put it in the county's newspaper, to say that there was the public hearing.
It'd be interesting to do like next year, like do a full on outreach, not full on, but information. Like really tell people, I'd be curious what they would tell us.
Yes, and I guess that's part of the reason for these open meetings is that they can come to any one of these and weigh in to us. So,
They
you
can
know,
come and do public comment. I know. Okay.
Knowledge is power. I mean, if you don't know what this is, and the chances are you're not going to show up. I mean, you know, want to show up? I mean, I do, but knowledge is power, right? We're doing this today. Here's your opportunity to do this. So we can consider.
But how would that interface with our budget, or not budget, but how, and so we're in September, we're doing our budget now. It's kind of finalizing in October, November. You get input in September. And to redo a budget, or even like roll some.
we are reworking the budget daily right now.
Okay.
So we could do that. However, we would put the caveat in there that we must meet our mandated service requirements. Most of those get eaten up with our personnel costs to administer those programs like child welfare, crisis, those types of things, or those type of services. But then on the other end of that, when we do have to provide services, those mandated services are foster homes, mental health institution placements. So those are like the big drivers of our budget. So if there's any money left over at the end of the day, after all of that is done, we could look at providing some different services or applying for grants with opportunities that would come up from these types of hearings.
So I'm looking at, I don't think that. If this is out of line, someone will tell me, I'm sure.
I know, wait, Malia, pay attention here.
I'm getting close. Okay, no, I was just looking, that our meeting in November is gonna be held at GAM.
Well, we have to talk to Dana about that
Okay.
because with the pandemic,
Oh.
we have not done it the last couple of
Okay.
years.
Okay,
So it is nice for the board to go down and they like to hold one meeting
yeah,
at the alternate campus down there. So we'll ask Dina if they're ready for that yet.
Okay.
My guess is probably not yet. It's a
Okay.
little early with the COVID.
we'll breathe on all the old people, not a good idea. Oh, there was something scheduled here, I was looking, I was staring at paper and it just said whole meeting at GAM in bright red in November. I'm like, Maybe you wonder.
Hold an 8 manner. I know, yeah, Golden Age Manor, so it's,
Committed to
yeah, you're probably right, we don't want to go through that whole.
it.
Probably not. How many times have you done this? Go lick your finger.
Oh, no, I don't do that. Just smashes it in my face and it's like.
Then you're sit still, eh?
Wow, our work plan is getting short.
Elaborated.
Down the year.
Yeah. Yeah.
A citizen contact.
Johnny B.
Somebody would be here, I could call him, oh, for the PFC, the Drug Free Communities Wings.
Oh, did you make the headway? Did he be in person?
He gave me a name, the lady that runs the cleaning business down there. She's one of the spearheads,
Oh, yeah, that, there's, dry cleaning.
the dry cleaning, yeah.
I don't know her, but I've taken my stuff there. Okay. Oh, good. Did you get? any
I think
headway?
they got connected with some.
Over by the-
Will it go? They are doing it.
Yes, because, let me see, here's the update.
They are doing it. Yeah,
Um,
sorry. Maybe we're not-
yes, we will present that Wheels and Wheels.
Yeah, so the Wheels and Wheels is already over.
Did present.
We did.
They were going, I know, I saw an email.
We were present at, present or present? Present. at. They were past.
Yeah, I saw an email last week.
But then we will be going to some varsity football and volleyball games. this week to Talk about drug-free communities. We have a pro-social, pro-sober event at the Apple Orchard. And we're meeting with 2 school districts to talk about vaping and resources that we can find.
Right.
So we're trying to fudge our way every.
Good. Well, Wheels and Wings is sort of crazy. Nobody goes, if I wanted to, Osceola World Fair, we thought that's the nickname. It's not. The fair, also, Osceola Community Fair. And then there's, Wheels and Wings, with cars and planes and sometimes helicopters. Yeah, the drag race, there's a 3/4 mile,
Generate.
quarter-mile drag,
And
and all the people with like chargers or whatever. Neighbor. He's got a big old charger. My culvert and his driveway are a 1/4 mile apart,
Oh.
and he would train. And my one neighbor, this was 3 years ago, she got so mad at him, she marched down to the shop. John, knock it off. Da, 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 da. Well, about 3 times a week. Just go by her house. I'm like, oh, John's home. Hilarious. So that's Wheels and Wings. Okay. Or you can take helicopter rides. You can watch old cars, old planes.
There are air shows.
Sometimes. Depends on funding.
it's the same.
I think I want to say that I went one there a few years.
Yeah, I think they have a. significant
I don't know, just maybe.
Oh, my God, I know. And the state wants 30 minutes, right? Obviously.
You know, next year we could just do the budget presentation as part of this meeting. Right? Something.
Then whoever was.
No, maybe it's got specific requirements.
Connie, would that work? Is there any reason we couldn't do our budget overview during this meeting? Just to expedite?
We need to have it reported on the regular committee meeting. Budget presentation. I think this is just public hearing, so we don't start our official HHS committee until 10 o'clock. So would that present an issue at all with having it on a?
Well, I think what you could do.
Or the chair.
Maybe we start this meeting next year at 9.
I think it has to last 30 minutes.
Is that right?
Yeah, we're doing the 30 minutes thing.
Sorry.
And
State.
Donuts.
But no, yeah, I mean, we should like have them 3-minute mysteries that we just read to each other and see if we get it.
We can do charades. Is there something that we do? What? Not to,
I don't think
you
so.
can't force something out of the law.
We can look at different ways to do it next year. Bring a friend.
Bring donuts.
Bring food.
breakfast?
No.
I like that.
Breakfast sandwich.
Bacon.
Bacon.
Like it makes everything better.
Duffler's.
I mean, like the staff, I feel like it's like a 3-4 brainstorm right now.
Well, I also would want to be careful with getting too many like.
Right.
That's right.
So.
I think it'd be better to just,
I mean,
Yeah.
and
just spread the word more. But we actually have people.
Would it make sense to
Yeah.
invite, assuming there's something like Polk magazine here? Get some representation from the medical centers, from the public office.
You mean to tell them to spread the
Well, no,
word
just,
about this?
just, well,
Make the invitation.
make the
Yeah.
invitation, they might decide that they would have a. what do we do now?
well, we could put it on Facebook.
If the idea is.
And that's
generate-
We're available.
I mean, I think my opinion would be is I think that you can't just invite certain groups. I would agree, Facebook would probably be a better avenue, because then but then again, it's just the people that follow us on Facebook that may see that. But if we're putting it in the newspaper and Facebook and, we're just trying to market it, yeah. What about Bob Zane too? The 3 people that listen to the Amory radio?
Is one of them the announcer?
Probably.
I think one of the big ways that we capture the needs of the community is through the community health needs assessment, and then we plan according to what data we've collected for that, and we can, the beauty of having the division model is that we can plug into all of that's within the division. Based on what the public is doing.
Top of the morning. Good morning, chief, boss lady.
Morning. Good to see you've got your badger wear on, means you're a proud badger.
Oh, yeah. I don't know if Reed will be here, or oldest brother.
Sorry. That would be your nephew.
Yeah,
Sorry.
Dennis Spelling. Yes. Take seven.
You and your family.
I hit 87 on Sunday.
Happy birthday
Happy
to
birthday.
you. Oh, my goodness. 87.
Party?
You always have.
I know, but did you have a softball tournament?
Well, I had to drive the Grand Marshal in the parade.
Oh,
I
right.
announced the tractor pull Saturday.
Oh, yeah.
I was 12 hours. Lost about half of my voice. Little bit.
12 hours? That's a
Uh,
long time.
We started at noon. Everything was a record. We had 220 hooks.
Wow.
It's half a big pull. And
That's at the World Festival, World, we were just
We
talking
had-
about the Wheels and Wings.
half of the tractors were from Minnesota. They had I guess what boosted it a little bit was the biggest pull in Minnesota, is at Mazeppa, south of the cities. And we had them all over from Elk River. Seward, Minnesota. One gal from Hastings won 3 trophies, first, second, and third, 2 different tracks.
Wow.
It was a young lady. We had a lot of women this year. I've been trying to get about half women and half men. And it was, well, I'll bet you there was 20, over 20 gals. Probably close to 30.
John, we're just hanging out because we have a budget hearing that we're open for right now until 10.
Oh,
We're just kind
So
of,
you just came in the nick of time to
Yeah.
keep us entertained.
Yeah, it turned out to be a great weekend, I guess, Friday night, they did have the track covered. But they started about 9:30, ended about 3 o'clock. I ended up at 11:30.
in the back? Yeah.
Maybe some corn.
back of
Well,
the.
Back to the ball field, there we are.
Except for the one that we drove through at the state, at that county fair.
That's how it goes.
Morning, chief. Now. Can't complain, nobody listens.
I would for at least 10 seconds.
Big shout out.
I didn't
It was this afternoon.
know, yeah, but yesterday she said.
Big shout out.
Saying.
Long and wet.
I just.
Words.
I got a little call, and they said, you going up to Ishpeming to broadcast? They said, no, they have their own system up there, and I checked, just to be sure.
No.
And I first, only been in that place a million times, but it's just cool.
Saturday. Yeah.
Yeah, it's just all.
And the tractor pull Saturday.
I was.
Yeah, Connor said she's at 5.
English, you pronounce it Beaver, from Elk River, Minnesota. But it's,
He was roughing last night.
I said, there's probably only 2 people that pronounce that. I told, but you know.
Kid from Auburndale, Mike Morris had worked. I said,
You
you let go on the
French
whistle. I said, the next one's on Sportsman, Mike. Well, he's going.
I,
I went over and told him, he said.
great grandfather.
He was great fun.
He was Napoleon's brother.
Yeah, that's one thing I won't.
What? Are you done?
Those kids were.
No,
In 1950 or 18?
1850.
Okay, I was gonna say Napoleon.
So,
Volleyball, that's easy.
all the religions and all the nationalities basically went by the King James Bible. And in the front of the King James Bible, they all had their family.
I could be.
My great grandfather came over, his name was Nicholas Pierre.
I haven't been home much.
Yeah, I know. He was married to, I've seen his wife. He was married to LaFleur and they had 4 kids and Napoleon was his brother and he was married twice. It's pretty,
Maybe so.
I don't have that Bible now, somebody got it. Out in,
I think we need Irish.
Yeah, Farmer Olson.
We're waiting we have a state, required half an hour hearing. So that's what we're doing right now.
Well, I asked Bob. You guys.
That's pretty cool, John.
It just stops, that starts tomorrow.
No.
It was very interesting when I read it.
Started.
But before,
Okay.
before my son Joe died, he had a family. He did it all himself. He was single, 35 years old. And he wanted to have that family reunion. My dad's first cousin was all gone, but most of them kids. Yeah, they came from Beloit and Florida.
It's like.
Beloit process. King James Bible, yeah.
We've got a lot of hate.
I know you.
I thought I was doing a bunch of,
Yeah.
He was
You know,
trying.
the COVID, because I had time. And my brother's got a bunch of it. He's got all the documents, history and all the articles about my great brothers. Monticello. But he's got like my great grandfather was the mayor.
Yeah.
And a judge.
And I'm
So he
thinking,
got
we're
all
just looking at
papers.
Australia and voting.
So I went to history, and one of the things I turned up is that one of my ancestors was one of the judges for the Salem witch trial.
Oh, that was pretty plain.
Bartholomew. That's what he said, 'cause he ended up on the right side of the law.
We had a couple of tractors there from Monticello.
Oh, yeah. Yeah,
Have you made it down?
yeah, I think it's like I lived there for many decades.
Actually, it's far there. We've got rice.
Any football games yet?
But Sapporo and Hudson.
Are you talking sushi now?
Is that right?
Sapporo, now I'll take all. Oh, Sapporo. Oh, so I was thinking of Aurora.
Farm boys down there, they all, them farm boys down there, they're all about 200.
They were big.
Yeah.
So good. Yes. If you ever get a chance, try that one out.
That's why they gave us the 20 cents.
There's a Sephora also in.
They may go to West.
Oh, yeah, yeah, I heard. Yeah.
Yeah, the all you can eat.
I still the last two,
So you're doing. Like the Minneapolis are part of NBC, and restaurant below it was like.
Very hard for me.
And,
It's safe.
Quarterback.
Oh, and I like the red bean.
That's not bad.
Anderson kid?
well, there's the Anderson and the junior.
Okay. maybe it's a junior.
Really required quarterback. I think.
Yeah.
You got
Yeah.
it.
Yeah. It's sushi below us. And an awesome reason to eat across the street for breakfast. She got, yeah, the Unity kit, Mexican.
Oh, yeah.
And, they also have that, miracle shit over there, like, you can go get whatever you wanted anytime. We're around here, it's something more like burger and fries.
Well, I guess, okay. Have a nice.
So I gotta fix it, I like that we're doing specialized place. It's not on highway 80. It's just one block. It's Oh, so they were- I wouldn't bother on that.
They're still working.
Yeah. Yeah, I mean, it's been about. So they may end up with 5 or 6.
Wonderful variety. The pies, we got. Yeah.
Yeah, I guess no, how they. Yeah.
And
Since I can remember.
Oh,
yeah. Well, you know, we.
There might be something.
Now, let's find out.
Ready for
Let her go. But we call you mean colors, no. And then at the end of the meeting, I was worried to observe.
back to see us.
Stop making it run, sit up, sit up, sit up.
Yes, sir. Yes. I was respecting my elder. Oh, yeah, thank you very much. They thought I was the office boy.
I actually.
Oh, yeah.
That is
Some things
behind glass.
I did some things are so. You know, I was getting a little.
Oh, were you? Well, I see it right around. Yeah.
Just fail.
You don't want to lose any more.
Thanks, sir.
Oh, yeah, you got.
Mine.
Oh.
That's why you need to be calls for me.
What you found? We're in the 3 meeting. Oh, I said, no, is there a budget meeting? She said.
Oh, I got.
Oh.
Bill, it's on the agenda for 11.
Boston.
11:21, but we ate. Oh, my God.
You know, look,
Oh,
I
my God.
can tell the story on the last. Well, that's what I figured.
We just spent.
Not public comment.
Normal.
Hearing.
You didn't miss anything, Diana?
They're magnets.
I did. No, that's not. Appreciate that.
Yeah.
That meeting, you know, 33, yeah. They're, that's a great group. I.
And they would wash everything out.
Going to public meeting.
Well, you know, another.
What's that? You get like 500 of them up here.
Well, I went up to the Arctic.
We actually.
Yeah, we worried about them. Okay, come on, Webster now this week, yeah, before you get to come home again. Okay.
That's
Closer than.
It's closer than.
You're all set. Oh, we got, he's our black.
I know.
I got a minute and a half.
When I was in EDRC.
Well.
Who was in the app. And she got in her car and was driving on highway 8. I don't know why I'm making this between Minnesota.
So we got that housing. You gotta have that kind of vision for the people that we're.
I've had several people, you know, when I first moved here.
With the West Cap last night.
Instead of saying Chicago, I would say Chicago.
That's good work.
I don't think so.
But they're saying we're gonna have a lot more to do.
That's
you know,
my,
because
that's my home.
We haven't,
That area.
we haven't built the house.
I said, we, you know, we had, when I grew up, when I was in high school, we had.
They doubled, like they call it the
So
quarantine, the people who
went
receive
all
the
the way
request. They
Superior,
have
Superior East,
doubled it
and we had the two
a year
schools.
ago.
They had
There's
Superior
questions,
Central,
so-
Superior East. We
They
went up
doubled
against
the
Superior
people,
East. that
And then they
was, you know,
redesigned.
3 times our size.
Like,
You know, and I had 800 in high school.
Online.
They were
do
still
that,
doing.
The
And then we
elected
went all
director
the way
and
up to
the
Marquette.
number 1 and number 2 people.
So we
on that
traveled a
team are
lot,
all
you know, yesterday
involved
we
in
did for non-conference.
Less than
games,
a year. And there's one person. who-
So Amy did,
But.
Yeah, they're just.
The rest of them are all coffee.
Um,
So. Anyway, they have a lot.
You'll be back.
They've got they're doing amazing work.
The original makes sense for the speaker.
Yeah. so this-
The hepatitis.
covered this.
Yeah.
But I did drive
Yeah.
up their project
Ready?
River Falls.
We close the public hearing. Okay.
Yeah.
You can call your meeting to order.
Okay, Claire, we're ready. We're gonna close the public hearing now, okay? And then now we're gonna reconvene and call to order the regular meeting of Polk County Community Services. And I would take a motion to approve our
I
agenda.
move we approve the agenda as presented.
Second,
Also take a motion for approval of the minutes in a second.
So move.
And do we have public comment there? Okay. And receipt of information from supervisors not seated as committee members?
You want me up here, right?
Oh, sure. You can go where you want.
So thank you, Madam Chair. For those of you who don't know me, my name is Brad Olson. I'm the supervisor from District 1. Here today to discuss just a little bit about mobile command center, mobile vaccine clinics. Did I get this?
Yep.
And so about a month ago, pulled a public records request on where the mobile command center had been, how many shots were given. Sorry, Mr. Chair, you don't get one because. No, that's all right. I don't care about it.
We can share. We can share.
No, thank you. So I do care. So these questions come from that public records request from the mobile vaccine clinic. I was told to, I guess, come here, kind of present them, not necessarily looking for answers today, looking for answers down the road. But out of 78 outings, 78 times we left Polk County, we averaged 16, a little over 16 shots a day, which is only two an hour on an 8-hour day, depending upon when we were there. I guess some of the major questions was at least 3 times that I could see August 6th, June 17th, and July 9th. We didn't go to what I would call an open house clinic. We went somewhere to necessarily give shots. If that was a farm, if that was a nursing home, wherever it is. So of these 3 instances, did we take the mobile command center there and why, when we could have taken a van, truck, car, whatever it is, at considerably smaller fuel expense to the county. 2 clinics were held outside of Polk or Burnett County, 2 different times. 2 clinics, each at Spooner, a total 17 shots, Cumberland 9, total of 9 shots, for a total of 26 shots in those. Why did we go to those counties? Who paid this out of county service, and what was the approximate cost to the taxpayers for those 4 clinics? As we all knew going in, we had the agreement to work with Burnett County, but these were outside of that. Of the 1,307 shots total given, what was the approximate cost to Polk County? What did it cost us to get us there? Many times it's been said the county needs a new mobile command center to reach all county residents. If this is so, why did we only go to 12 of 36 municipalities within the county? If we're reaching all residents, why did we go to villages and cities? It says no towns, but when I got looking, we stopped at Frontier Ag and Turf twice in Turtle Lake, once in Osceola, which would not necessarily be within a village. But we never went to the town of Alden, the town of Farmington, the town of Garfield, 3 of our largest populations. We never reached out to those communities to go there. And roughly 2/3 of our population, we never went to their town to try and give shots, period. At any point did we, HHS, reach out to municipalities, churches, or schools to see about using their facilities for vaccination clinics? And if not, why? Why did we spend over half of the vaccination clinics, 31, in Balsam Lake or St. Croix Falls, compared to 26 covering the rest of the county, when 2/3 of the population live in the rural area? And then I guess lastly, please explain why HHS feels the county needs a new mobile command center for vaccination use, when currently over the last 10 years, from October of 21 to August of 2022, the mobile command center was only used for vaccinations in the month of June. And then, and I apologize, I'll leave this with the clerk. I didn't get these printed out. But, 1, 2, 3, 4, 5, 6 different times, we stated who we were giving shots to. You know, when I got my shot at the county board, it didn't ask me what my job was. It didn't ask me where I worked. And yet 6 times we went out and stated that we gave migrant workers shots. I'm a little disappointed in that we've picked on that group of workers to specifically say we gave shots to migrant workers today. You know, we didn't say that we went and gave 20 shots to the employees down at the local business downtown or out in the country, wherever it's been. And then, one last thing, I guess, is once, besides the Spooner and Cumberland outing, we made it into St. Croix County to give shots in the town of Emerald. I guess just wondering how it is. We got outside these counties. I never seen anybody else coming into our county. But Madam Chairman, thank you for your time and board members.
You may ask any questions.
No, I think we should just keep on our agenda
Okay.
at this point. On our agenda.
Okay.
Okay, are you doing our update?
Yes.
COVID monkeypox update.
Okay. As of today, Wisconsin has 56 confirmed cases of monkeypox. Done in St. Croix counties, they have a confirmed case. We had one suspected here in Polk, but it was negative. Monkeypox cases in Minnesota are at 160 confirmed. Our level is low for COVID right now, which is good because we bumped up to medium for a bit there, and now we're back down to low. We are testing about 50 people per week at our community testing site at the government center parking lot. And we are now sharing free home tests with people who come in for testing, so they can have a home test ready to go if they do symptoms, come down with symptoms. We are planning a mass vax based on the popularity of the drive-through clinics with the COVID vaccine. This time it will be for the bivalent booster shot, Pfizer only, but then we're also offering flu shots with high dose availability for 65 plus. There's 3 clinics planned, 9/27, 9/29, and October 5th. So we've got 50 people signed up so far, but we've ordered enough vaccine for 900 to come through that line. We're working on this is just other public health stuff, working on the community health needs assessment. We'll start doing our survey at the Mass Vax. Good captive audience while they're sitting there waiting. We did that for ADRC. It worked out really well. School flu clinics have been scheduled with 7 out of 8 of our districts. And just otherwise, our drug-free communities grant is ramping up. They were at the Wheels and Wings events, visiting some home volleyball and football games to promote drug-free communities, holding a pro-social, pro-sober event at the Apple Orchard on 9/24 and 9/25. And then we have 2 school districts who are wanting to talk to us about vaping training and resources that the drug-free communities grant can provide and partner with the schools on. So we put it out to all 8 districts so far. We've had 2 nibble on that. And then we just did a safe serve class with 40 participants.
What's big, sir?
Restaurant, so serving safe food,
Like a food safety.
class. Yeah, we're good.
Okay. And how are we doing for getting volunteers to help on the mass vax? Do you need us to help with that, or?
I think she's got good participation, but we would always take more interest. I know they were contacting former volunteers. We've got some nurses who will come back and help us as casual to administer the shots. So if a volunteer, it's different for COVID shots because they kind of opened it up for different categories of people to give the shots, where the flu shot would have to be done by a nurse or doctor, different level of criteria for that. So we'll keep an eye on that.
So we have enough for, otherwise, spread the word.
Otherwise, for the
Big numbers.
we'll put out an all-call if we get tested for volunteers, but it sounds like they're doing okay.
Okay.
We are only offering Pfizer for the the booster, just because we can hit more age groups. And with us giving the different flu shots, we just wanted to keep it more simple. So Moderna is available in the county. It's just not going to be available for our drive-through.
And our flu shot drive-through is only 18 plus.
Yep.
Because we have vaccine VFC, so they're on Medicaid. It's just different lot numbers, and we are going to the schools. We decided that most of those kids can be captured in the school. So
Lots of behind the scenes rules and regs now that we're getting back to normal. So
yeah.
trying to keep it simple for the people actually giving the shots, but then also that's why we chose the Pfizer. That's 12 plus.
So during the day of the mass vax, a doc who can, or nurse that's qualified to give the flu shot might be kind of roving up and down the line. Everybody will be doing COVID and then they'll be popping in if somebody wants a flu shot.
Could be, I don't know how many cars they're going to put in the stalls. I don't know if we'll be at the 20, what was our high number, 23 cars at one time. I don't know if they're going to do it.
Well, that'd be like 2 shifts if you only have people showed up.
Helen is the master behind all
Yeah,
that
that's good.
coordination.
Yeah. that's good.
But I know she'll pull it off just fine.
But 900 between the 3 days.
300 flu shots a day on average.
Oh, I see what you're saying. Oh, but we only have 50, so we have 50 signed up, that's all signed up.
Oh, yeah.
Okay.
It just got posted.
Yes,
on-
yes,
yeah.
yes.
Yeah, so I think we just started the marketing.
So the Moderna vaccine is available through county, but not at the price.
We're not doing Moderna for
You're
this.
not
booster.
doing Moderna at all.
Mhm.
Available on
And you
its way.
can mix and match. So the FDA has said that yes, or the CDC has said that yes, you can mix and match. So that's going to be a personal preference. You do mix it up a little bit.
Wow. We'll spread the word that there's vaccines available.
Right, so rather than doing our traditional, we would set up at the church or set up in our lobby and people would come in for shots. They get to drive through now.
So even for the flu shot, even if they just want a flu shot, they can do this drive-through. Because I don't think we're doing our other flu clinics. and stuff.
Correct, yep.
Which is-
We'll try to maximize our resources and get them all through the drive-through in 3 days.
Well, people love the drive-through. They do. I mean, that's the thing I hear the most about is how great it was to do the drive.
Yeah.
So it's so easy and you just get to stay in the car. Are you good? Any other questions on that? Okay, the information regarding unhoused.
Do you want the, mobile vaccine clinic or is?
Yes,
you
I
kind of
do.
summarize
Yeah,
it
yeah,
here?
okay, I misread that. Yep. Yes, please.
Okay, well, I was going to report that we had 78 clinics, mobile clinics last year. And 1,307 shots were given, vaccines were given at those clinics. And then we switched over and did testing. And we administered 542 tests from May 16th until July 22nd. The reason we stopped July 22nd is because the command post needed to go in for repairs and then they were using it for the fair. After that, it still needed repairs, so we just haven't gotten it back yet. We're set up in the sheds down there, lower level government center currently.
And I can just say, I saw a picture of where we have our people doing shots. It's next to a gas
Not
can.
shots, tests.
Test. Gas can, a lawnmower, stack of pallets. I'm like, okay, here we go. Anyway, just one more, how I felt like, okay, maybe this mobile clinic unit thing would be helpful. Okay,
Madam Chair, may I make a comment?
yes, please.
You know, as long as we're taught to mention the command center. We heard her presentation there, and there was some miscommunication all over about shots and different things. And I don't care where that command center went or whatever. We tried to get the people and get them to understand and make them to the closest place available. And I just think we've done a fantastic job of reaching out. And I think we should feel very, very dedicated to the people that did reach out wherever it was. I don't take any basics about this fact, and that fact. They did a fantastic job. They reached out to the people wherever they could. And a lot to the whole company. And big thank you for every place you went and everything you did.
I'll second that.
Yeah,
I agree with that too, because I think that a lot of times we had people who had willing arms, were willing to come in and get their shots to protect themselves and their neighbors and their families. And sometimes people have transportation problems, and I think that it's good that we use this command center, because otherwise it's been sitting in a parking lot somewhere and not being used at all. So I think it's very worthwhile things that you were doing.
Thank you. We were definitely glad we had it and we used it for our drive-through clinics as well. So it did get some good use over the last couple of years with the pandemic. Once we started.
Logistically speaking, and from experience of having to do annual HAZWOPER and first aid CPR training, it's a lot easier to roll in with something that's prepared for a task, rather than hauling stuff from a car into a building, trying to get people to help you. Oh, the door's locked. That whole setup, tear down to me is time equals money, okay? The time it takes to coordinate logistics when you don't have a mobile facility that is geared and set up to react like that is a big deal.
Agreed.
and can the minutes capture some of this conversation on Savannah? Can you capture some of that? Okay. Yeah, I can't even imagine the schlepping.
That was awful.
Well, and then just the exposure risk as well, when you are walking in and out, it's a different thing if you're all sitting around, in a space that you don't have control over either. What's the ventilation like? How big is the room? I just feel like that's another, and we're not done with COVID. It's going to continue being our life for a while. And who knows, monkeypox, and then what's next, who knows. But anyway.
Right. So I think an important message in this is that we are the secondary users of that mobile center. The primary use is for that 911 backup said they go to Barron or St. Croix and then they're sent back here to be dispatched out. So I think that's an important clarification. And then also Vince has asked that we work to get the price down so we can find something more affordable. So he has tasked Chief Deputy Burrows with that. But we are happy to use it as a secondary user to keep the wheels rolling, and whenever we can, as we've seen, it was very beneficial to us to have it ready to roll, provide mutual aid to some of those other counties that were requesting, they just couldn't get out. The Emerald Farm, some of these other places, that's what we do. That's what law enforcement does in an emergency. That's what we need to do. And that's what.
That was going to be my question, was when we had Supervisor Warndall give his statement on how important the mobile command center is for when, youth go missing or anything like that. No, he had firsthand experience of how, whether or not the mobile command center had sat idle for however long before that, when it was put into action, how critical and vital it was to have it. And then also the testimony that we've gotten from other county officials about the other uses of it besides vaccinations. I was going to ask why we focus so much on this vaccination fact sheet that we were given, when that seemed more like a secondary use to its primary purpose. So I'm glad that we clarified.
Right, and mass casualties are not gonna go away, and they will come here. I don't know when. And I pray to God that it's
You're wrong.
right,
But you might be
right? Like
But yeah.
I'm 87 and, I don't want to say that, but
Are we gonna?
failing to plan is planning to fail.
Right.
And we're also going to have more serious weather events because of climate change. We already had a tornado.
Can't go there.
And so there's more weather, there's just going to be, it's going to be hotter in general around emergencies, disease, mass casualty. I mean, it's not gonna get quieter, it's gonna get more intense. And so having the ability to respond in a way feels really important in a quick and efficient way. It seems really important.
Madam Chair, the comment about migrant workers, I have a lot of them in my community. I have 5 big farms around there. And they're green card people. And they're very proud to be labeled as migrant workers. And I think we should respect them.
Well, I suppose we could not necessarily put people's work on there. I don't know how, I mean, I don't know.
No, it's
Is it
just
fine
fine.
the way- the way we do it?
Nothing should be differentiated.
Maybe the differentiation is the fact that they're not county residents, that they're in a migratory status.
So on that note, we did not deny, we were not allowed to deny anybody vaccine because of the federal program. Vaccine was free. We administered it. No county lines, no borders. So whoever came got it. No charge, at no charge.
Was there a requirement, Tanya, someplace on the Fed regs that you had to keep track of who actually got the shot?
We, through our Wisconsin immunization record, we keep track of who got the shots, but that's how they would extract the data.
Okay, and that has to be reported out.
I don't know if the state is reporting to the CDC on that level who all got the
Would
shots
that be
and
public
residency.
information though?
We would have to drill down some on that. There is a dashboard at the DHS that will tell you how many residents got shots, so you can look by county.
Right.
It doesn't say where they got them. It could be at St. Croix Health. It could be,
But it is something that could be reported out.
yes.
So I would have no problem with that at all.
Mhm.
The other thing is I would hope that there are no catastrophic events in the county where you're gonna need a command center. And I think that, if you keep your head in the sand, regarding a command center, that is the wrong thing to do, simply because you need to plan ahead, whether it's this county, Burnett County, St. Croix County, or anybody else that's gonna need help. And it's important, to the residents of the county that you're prepared. If you're not prepared, we're in trouble.
If you don't have the vision, we're not prepared.
Absolutely.
We might ask you to come back to the county board. when this comes up. We'll see.
I've been there twice,
I-
3
I-
times a charm.
And
I have no problem with that, but again, it's one of those issues that should not be put on the back burner.
I just want to caution everyone, the mobile command center is not on the agenda.
I understand that, but I think the door was open and
It's
I'll
on-
relinquish the rest of my comments.
So what I will do is talk to Mr. Netherland about how to answer these and what we do with that from Mr. Olson.
And,
No, I said, okay.
well, I was just gonna make sure that everybody understands the 911. So we had some misunderstanding early on. So 911, if there's if we need to use a dispatch, an alternative dispatch, it goes to a county, then county, St. Croix County or Barron County needs to be able to send it back to us. So there was at one point where we thought that another county would cover us in the case of an emergency, but it we have to have a place to come back and say, go to Mrs. McGillicuddy's address over here, and that's what we need. Does that make sense? Anything else?
Not on this topic.
Okay.
We got, yeah, it's not on the agenda.
Okay, all right. Information regarding unhoused individuals.
Okay, so last month you had asked for some information on homelessness, unhoused. So I did my best at gathering data. And I want to use that as a clarifier because there's all kinds of data out there and it doesn't really match up. So it depends on who's reporting, what their criteria are. We just kind of did our best with the information that we had readily available to us to be able to bring this information to you and then maybe have some suggestions or next steps for the next meetings on what we do. Okay, so go ahead, Claire, in advance. I thought we would start out with the definition by the Housing and Urban Development HUD. You've all heard of HUD, right? So it, any one of these bullet points is considered a homeless person. So they lack fixed, regular, and adequate nighttime residence where their head is hitting the pillow. They have primary nighttime residence that is public or private, not used for sleeping, like in your car, an abandoned building, campground, I should say campground, something like that. Somebody who's living in a supervised publicly or privately operated shelter. So hotel, motel, through a voucher program, congregate shelters, or transitional housing. Or they have resided in a shelter or place not meant for human habitation and who is exiting an institution. So like somebody who's just released from jail would be an example there. Or they will imminently lose their housing within 14 days. So they're getting an eviction notice, they're going to be homeless. And then unaccompanied youth and homeless families with children defined under federal statute who have experienced long-term period without living independently in permanent housing. Health purpose comes to mind. So staying with my friend, my mom, my grandma, somebody, it's not permanent for them, a temporary living arrangement. Next slide. So when we looked at the data, my first go-to is always my economic support people. They're kind of our experts. They're the backbone of all of the work that we do in community services. So I asked Diana to come and tell me if I misspeak as my subject matter expert. But we looked at what type of data they have for people who are requesting public assistance. So when somebody walks in and says, I need medical insurance or food share or some other type of public assistance program administered through economic support, they ask the question, are you homeless? If that person indicates yes, they have two follow-up questions. Do they expect to have regular nighttime residence in the next 30 days? And have they experienced homelessness in the past 12 months? So they're collecting that data. Diana, I don't know what they do with those two questions or if they're just data points that the state uses.
And potential referrals to outside resources.
So if the worker's here, oh, homeless, we're gonna get you connected to our navigator. We'll get you connected with WestCap, other resources to meet that immediate need. Okay, so then next slide, please. So we looked at statewide. The IM management reports are the reports that come through economic support. So Rita, do you have a PowerPoint to follow? There's a right up there. You were just looking like one-eyed like you. So statewide, 1.4 million people are receiving some type of public benefit in the state of Wisconsin. Of those, 61,000 have reported homelessness, 61,311. So if you do the math on that, 4% of the total people receiving public benefit are reporting homelessness. Of that number, 13%, 8,095 of them are children. So that just tells me that they're households who are reporting homelessness. Next slide. So we bring it a little bit closer to home in the Great Rivers Consortium. That's the 10-county consortium that Diana is the Polk County manager for. Do you want to rattle off the 10 counties? I know you know them.
Karen, Burnett, Chippewa, Douglas, Dunn, Eau Claire, Pierce, Polk, Troy, and Washington.
And there will be a quiz on that at the end of this.
I want you to do those in inverse order.
So it's our northwestern Wisconsin counties, right? We have 114,000 eligible members in the 10 counties. Of that, 2,396 are reporting homeless. So the math on that is 2% of individuals are reporting being homeless. 274 are children. So again, you have housing units, family. Yes.
So 2,396 homeless. And out of those 2,396, 2,325 are tribal. That's the way I'm reading that.
I don't know if I can read that. No, that's just 2,325 are reporting to be tribal members. So it would be about the same.
Out of the total.
Oh, okay.
About 114,000.
Okay,
Yeah.
all right. And this is just people who are connected to the system.
Yes. Yes.
And so we gotta assume these numbers are low because there are people who are free floating and are not connected to the system.
Yeah, this isn't a totally accurate number.
No,
it's just what we-
but it's just conservative,
Yep.
super conservative.
Okay, so then let's go to Polk County. 10,887 eligible members. Of that, 166 are reporting homelessness. Math is 1.5%. Of those, we have 14% being children, so 23 children under 18.
For us here in Polk County, those numbers are probably a little down for us since the homeless shelter closed. Because we basically end up referring most people out to Grace Place down in St. Croix County. And then when we speak of homeless for our population here for economic support purposes, the bulk of those are going to be individuals that are residing and bouncing from house to house. In the summer, we will have homeless individuals staying in many of our parks within the county and that sort of thing, but majority of the time they are individuals just bouncing from one spot to another.
Can I ask you this question? Am I interpreting the data right, that this Great Rivers Polk County, that this 10,000 is roughly 24% of our population?
Yes.
I'm reading that correctly.
And do you anticipate these numbers shifting as some of the COVID supports are disappearing and evictions and things are going to be?
Funny, I just had this conversation with Bill earlier today. In 2023, the pandemic, most likely beginning of the year is going to be federally is going to be ending. Across the state of Wisconsin, 1.5 million people will have their benefits redetermined because they have been on regardless of situations and income for the last 3 years. And so we will see a number of individuals over the next year due to unwinding. It'll take us about a year to do that, that are going to lose benefits and have an impact in their household financially. So it is potential that we will see a large increase in number. Thank you. Yes.
School data. So the other source, we know that schools have liaisons connected to homeless children and youth. So I drilled down and pulled the Polk County data. So the last reporting year is 2017, 2018. But I think it's like a 2-year lag for schools to get that up on their
It is.
website, on the DPI website. So it's a
Yes.
little bit older information. I tried to get more recent, but it was not able to get that. But you'll see of the 8 districts, 7 districts.
Does that mean that the 2017-18 data is actually from 2 years prior, or that's just the most recent that we have?
That is 2017-18 that's being reported at the end of 19. Leg, Mr. Lehman.
Yes.
And so none of this shows anything that has to do with COVID.
No.
These are all pre-COVID.
Yes.
These are the old days,
Yep.
old thing.
I have a question about it. Would this maybe, does this mean they're at a snapshot that's how many are homeless or any throughout the school year? It could.
So these are really good questions that I don't know the answers to, that I would like to invite the schools back to talk about. Because I'm not a subject matter expert on schools, so.
Because it only says 23 right here. No, that doesn't.
Yeah, so that's why it makes me wonder if at one point a child was homeless and maybe,
They were grandma. or
yeah.
Auntie.
Good questions.
But that's also, that other data was just based on people on the public assistance programs also.
So the elephant in the room being that Unity could be reporting differently than.
Right, so I asked Mr. DeWitt, who is the liaison for Unity, and he said that they had more defined ways of reporting. But I would like to put them back here to talk to you guys about what that means.
And our data, just so you know, was in point in time. So the printouts you have are from, I think, July. That's just for the month of July. It's a snapshot of July. It's not a cumulative number over
Oh, yeah.
a year. It's just a snapshot of it. Yes.
So if they got benefits in January and they're still getting benefits in July and they're reporting homeless, that will show up on that number. That was of the people who have requested benefits and are on benefits, those are the numbers. Does that make sense?
As well, the school's data could be cumulative over the school year. or something like that.
Yeah, at any one point, a
Yes.
child was homeless and they're counted, and maybe on this date you look, they're not that many.
Yeah.
That's, yeah.
I was gonna say, a lot of times when they come in, when someone comes in and registers a student, that student may not be living with a parent. And then they're considered to be homeless. Could be with grandma, grandpa, aunt, uncle, could be a guardian ad litem, could be just about anyone, a family friend. So it depends on when that student is registered. The other thing I would tell you is, with the Polk County seat being here in Balsam Lake, a lot of those kids will get closer to the county seat because of benefits, and then will be enrolled at Unity. And with the other 7 school districts, that information may not be accurate because they're gonna have a different definition of what homeless is or homelessness is. So it would be important to have somebody come from the district and report that information home.
So the next slide is just more of a statewide snapshot. Looks like back in 2013, 14, it was all-time high. And this is kind of covered right around that area over the next few years. So when I was doing the research, one of the principals I spoke with said, maybe it's the McKinney-Vento Act, which is really, but you're probably more familiar with that than I am. But basically, it's just information that the schools are required to have a liaison to ensure that the homeless youth are identified, enrolled, and have equal opportunity to succeed at the school. They have a requirement to participate in professional developments offered by the state. Ensure that the other school personnel are trained. Ensure unaccompanied homeless youth are informed and receive verification as their status as independent students when they're applying for financial aid, when they go on to college. They ensure that the homeless youth and their families are referred to services like economic support, mental health services, whatever they're identifying as the unmet needs. WestCat probably as well, housing resources. And then they are required to disseminate the public notice of the McKinney-Vento Act rates. I do have information on it, but again, that's not my wheelhouse, so we can have the schools talk about that if you do ask them to come back.
I actually have a friend who crafted that law, and she has a website which I will share to anybody who wants it. I'll just share it to the committee members if you're more interested. She also has written a book about homelessness in suburbs and rural areas because it's generally underreported and invisible. But she has made it her life work. She lives itinerantly herself in a van, has been for 15 years now, crisscrossing and capturing the stories of families experiencing homelessness in places like where we live. And so there's all these videos, and she's incredible, and she might be a really, she could come in on Zoom if we want to hear from her as well.
Why don't you send it to me?
I will
and
send it to
send it
you.
out through blind copy.
Yep. So I'll send you her link.
I know you had given me her name a while back.
I did, but I also could, I don't know, I think I keep buying the book and lending it, but I'll probably get a couple more copies. She's my hero.
Just one comment in there, that McKinney-Vento Act, basically is an expansion of the 14th Amendment, which is basically no discrimination against anybody in its due process. I will tell you that it has opened a lot of other doors, especially for free and reduced lunches. That is another thing that most people just don't understand, and who qualifies for that and how they qualify. But if you're deemed homeless and you're living with someone else, and you come into a school district, whether it's in this county or in this state or any state, and even if you're 18 and below or 18 and up, it's still school age, you automatically qualify for free and reduced. And then I will tell you that many times I signed the free and reduced application because the person that was taking care of that 18-year-old was another 18-year-old. That did not qualify because of no relation. So it put it, and it put the burden on an administrator to sign off on that, because when you have a federal audit and they, they automatically just pull, we don't get to pull the audit sheets for free and reduced. Somebody comes in and pulls them out, and then they see my initials on it, they couldn't say why. Well, then you have to explain to them why that is. So again, it opens some other doors there. Also immunizations. There's an umbrella of things that people just really don't understand when it comes to school age children in this act. We do our best. We do our best.
So, next slide. Thought I would talk about like known to us barriers for securing adequate housing. Three top we could think of were lack of available units, unaffordable rents, and ineligibility for subsidized housing or both. So you the ineligibility one, the number one reason is if you have a felony conviction or you don't qualify. So I think that's a huge barrier for people. You'll see one of the people that we want to bring back is probation and parole to talk about what happens when you can't find housing for your people who need housing and they don't qualify for these programs. Okay, so next slide. I thought I would give you what are the fair market rent amounts in our area, so you would have some type of baseline to know what is affordable rent around here. We use Eau Claire is the closest to us. So you can see like a 2-bedroom for 2022 is $836 a month for fair market. All the other metro areas are included in that, but then we like to drill down and bring it a little bit closer to home. So next slide. I looked at St. Croix County. They are the top one. They fall right in with the metro area. So they're competing with Twin Cities. 2-bedroom fair market rents in 22 is $13.29. Last year it was $13.08. We go east a little bit over to Barron County, and we're a little bit closer to the Eau Claire market, where 2-bedroom is $811. Last year it was $734, so it's a little bit of a jump there. And then if you look at Polk County, I think we're probably right in the middle of Barron and the Twin Cities Metro, $893 for a 2-bedroom and $834 for the 2021 for 2-bedroom.
That kind of speaks to the lack of available housing, because in those metro areas and things like that, we've got more available developments, more available units, so there's competition, prices go down. Here, we don't have available inventory, so prices can be almost whatever they want. So that's when you play that, or when you put up that other slide, that was the big thing that popped up to me, was lack of available housing and unaffordable rent.
Mm-hmm. Right.
But I think our figures there in Polk County is very misleading. But, like from our county line, we're 28 miles, 6 miles from St. Paul, and 15 miles from Hudson. So we are much closer to that 1,300.
I would imagine down there, the rents get higher and higher, right? So this is just the average of Golden Frederick, and you're gonna pay $500. Down by Farmington, you're gonna pay $1,300.
Right. And down there.
Yeah, I mean, you even see it with the housing market. If you look at a house in Somerset, you're paying a lot more money than you are.
If you can find it,
Right.
we have some homeless people down in that area.
increase that dark report.
Okay, next. So one of the things that I came across when we were doing this research, was a rental assistance program that was launched in March of 21. And it was due to the COVID pandemic. I'm trying to get from West Cap if that is going to be ending at the end of the pandemic when the public health emergency is over. But he's another one of the guys that I want to bring back to talk about these programs. West Cap is a huge resource for homelessness and rental assistance programs. But just came across this, it's out there, it's available now. $311,000 was brought back into the county in rental assistance from March of last year to December of last year. So far this year, 148,000 in rent vouchers has come in to help people pay for those higher rents. So it's just one of the resources that we are able to get people connected to.
I was at the West Cap board meeting last night, and I think it is gonna come to an end. Things are going awfully fast, but it's, again, the whole trajectory is they've doubled the staff they have for intake because the needs are so high since last year even, and last year was pandemic time. But they have doubled the number of people who are receiving requests for rent assistance, food weatherization, all that. It's just skyrocketing. So,
Can I ask you a question? I don't know if you know this or you know this, but this, between August this year and last year, are we on pace to hit that roughly 300,000 that we did last year? Or is this 2022 number less because people are stopped now?
well, there's a lot less households, 80 versus 36.
I know, but where are
So
those people?
where are those people?
Working?
You don't have to guess.
Well, people are back to work, but even with a lot of our programs, people have tapped out like as much as they can take out of some of these programs. Too. You know, they have maximum allotments per household, and things like that. So a lot of them might have just tapped out. Maybe there were. And there are a lot of people have gone back to work. That is true.
Well, there's gonna be an issue with the utilities, because, my electric bill went from $170 a month to $260. Like, it's ridiculous.
What are you doing?
I know, right? Nothing, and I was on vacation part of the time.
Well, they added that, I forget what they called it, which is basically a cost of energy increase. Because ours went from 90 to 180.
They just wanted that windfall tax.
Mine's always been high.
I was wondering
Yeah.
what happened to mine. Okay.
Well, and at the West Cap new building in River Falls, which is getting a big national award this week. They have solar array, and it's gonna be fixed. I mean, the first month was $38 for everything, heating, everything. Cooking, lights, everything. And then it went up, because of the increased use during the heat wave, it was 72, but it's probably not gonna get higher than that ever.
Wow.
Ever, because sunlight is not gonna change. So West Cap's doing such cool things of connecting affordability and sustainability. That's just like brilliant, like make it more affordable to be able to live in an apartment and not have your utility bill double because the utilities just decide they won't, they have to increase it. So anyway, be great to have Peter come.
And with a number of these programs ending, individuals have not paid, say, for their heat and electric, have not paid any money on their utility bills in 3 years. So as these programs start to drop off, they are gonna be tasked with back to budgeting their money and making those a priority as well. So as a person that has ran the energy assistance program for 3 years, a lot of people have not paid any money out of pocket.
Because there was no moratorium.
There was unlimited funding and guidance from the state that we were not to ask people to contribute towards their expenses. So if they requested, they received.
So this was a COVID management.
Yes.
And no shutdowns or turnouts.
Well, Pokernet was here, Pokernet has always been able to do that, even under COVID, they could do that. All of our other utilities that are Class A utilities, they could not.
So next steps, key takeaways here, our data is different depending on who's reporting and what the criteria. Really hard to pull it all together. It might be hard to get more precise numbers. We don't know who is living in their car, if they're not seeking benefits or coming across our thresholds at any given point in time. And then I think there's programs and resources available. Some might be at risk of being defunded, but we want to be able to bring in subject matter experts to talk about what are the barriers that they're facing, what's out there currently, and how do we match that all together to figure out what the real need is. So that's what I would propose to this group to, invite some of these other areas back to talk about their programs, what's available, and what are the unmet needs here.
I was just reading, that there are multiple, programs for seniors. Only 40% of people in the country are using them. Unfortunately, I don't know where I have the list, but there's umpteen programs.
That the seniors aren't getting connected to the programs.
They're not getting connected to them. So I don't know if maybe our team here in senior assistant knows about them, but how do we disseminate that information to the public? And of course, the children, you have the earned income tax credit and the child tax credit. And so those are things that we can maybe disseminate. Maybe all.
Isn't that ending?
I did ask ADRC about the types of calls that they're receiving for homeless or housing. I guess it's just housing is how they categorize it. And they said that there's two main categories. One is older people looking for resources to come into their homes and provide services. And then the other are affordable housing. So the younger population looking for affordable places to rent. So if somebody is struggling with housing or anything like that, I would send them to the ADRC. They'll give that unbiased opinion. Here's what's available to you and get them connected to those resources.
Any thoughts on this? Next steps? You like it?
How does, and maybe Mr. Netherland can answer this, how does economic development fit into their office fit in with housing development, if they do or not?
Well, they have, in fact, lately by working with the committee to look at the potential for senior housing with the idea that it would increase volume of available units in the market. Maybe seniors who have a home move into a senior development type situation, working class or other folks move up. So there's kind of a dominant effect. That's one thing that they're proposing. He also looks at housing, I think, from a business standpoint because he works directly with the businesses of the county. And one of the biggest complaints they have is we have to find employees and we are recruiting from outside the area, but there's no place for them to live. That's the kind of stuff he hears. So he looks at any venture to increase development housing wise to help the businesses.
And that's certainly going to have a tie-in to public transportation.
Possibly. Just as I listen to this housing presentation and Tanya sent it to me, the key challenge for this committee is what do we have in front of us? What's this information telling us? And then as a county, what can we do to affect it? I mean, from our small county perspective. And Tanya's come to me this morning, I think was excellent. She said, what are we better suited to do? We have to know who these homeless people are and how they're defined. Do we help them find a job? Do we train them? Do we give them daycare services? Or are they folks who are unable to work? So I think it's similar with housing is what do? We have to sort through this information first so that we can, in our small way, say what can we impact the biggest way with what we have available.
And I think another question is, where in the county is there low income housing?
Bulk of it is in Amory.
Emery's got pretty beautiful.
The majority of low-income housing is in the city of Amory.
Okay, and what constitutes low income housing?
They're gonna be income based, but then they too are gonna have that whole background check and gotta have somewhat of a certain type of a record to be able to rent in those environments as well. And then the rest of our housing it's gonna be for our elderly and disabled. That's gonna be spread out throughout the county between Osceola, some of our housing authorities. Impact 7 has some like in Centuria Meridian.
Right.
They have some of that in Centuria. So it's kind of spread out, but the majority of our low income housing is going to be in Osceola or in Amory.
And what are the waiting lists like?
There's always
don't know.
waiting lists.
There's
On
always-
Section 8 voucher, I think there's been waiting lists forever. And that's where you can rent a regular house with a voucher program, probably like this WIRA program, but there's always waiting lists for those.
Madam Chair, I'm Polk County rep on our Polk County Housing Authority. And we have a meeting every month, every third Thursday. Senior Center. And I asked a question last month if we thought we could ever be expanding. I think it's been that's 30 some years ago. And I asked, I know there's a need, and I asked. Doesn't seem anything possible.
Did you say why?
It's, everything is on the Polk County housing, everything is based on federal and state funds.
Who's gonna build it? Who's gonna pay for it?
Yeah.
Gone are the days
Yeah.
of the 3M Barton neighborhoods and the
Exactly.
up by Houghton,
Right.
all the mining houses and I mean, I worked for Eastman Kodak and Rochester, New York, pretty much was built by the employer for the employees. So that's history. So the challenge is to figure out how to do it, maybe how to partner with larger businesses in the county to help.
State and federal funds, you aren't gonna see that on the horizon.
You can take advantage of those when they come, but you can't rely on those.
Right.
And as far as waiting list, we have,
So
everyone had quite a list.
we'll learn more about this, I think in the upcoming county board meeting. But economic development is, I'll preface this with, this is one solution for one part of a large problem. It's not gonna be, there's no magic solution that will all of a sudden stem all of this, but multiple efforts in multiple areas will, inch us towards where we want to go. But economic development is working on one program to incentivize private developers to come in and build senior housing within Polk County. We don't need to go into the details now, but the idea is just to incentivize people or incentivize them to come in and build something. And like we said, then it's that trickle down effect of, my parents are an actual example. My parents sell their house on the Cut Across Road in Centuria. A family moves up into their house. That family's, unit becomes open and an apartment opens up underneath them. Originally, EDC was tasked with coming up with a housing effort in general. And it sounded like it was criticized as being too broad. So that's why they moved to senior focus, the focus on senior housing. The fortunate thing about that is that you can, in theory, and probably a good theory, kill multiple birds with one stone by building that senior housing. And you had asked about wait lists, EDC, and I think there was another study showed all available senior housing in Polk County is at 0 capacity and long wait lists. So there's
Subsidized,
need,
or
sorry,
subsidized
right, but I believe even for,
in general.
yeah,
Like
yeah,
long-term care.
Like I live in an elderly neighborhood, I have a lot of elderly neighborhoods, and they talk about, they don't need subsidized housing.
Right.
They would be willing to move into a nice 2-bedroom apartment for the elderly, but it doesn't need to be subsidized. So I think that's the big thing is subsidized is important, but there is a need for people that want to live in or would move to an apartment, but it doesn't need to be subsidized because they're at or above that income level.
I'll be careful with, inserting my own opinion too much, but that is where, I used to be of the mindset of, like, oh, rent control and income, driven rents sounds so great because you can control everything. But the thing is, at the end of the day, if you don't have inventory of market rate housing, there's no incentive for anybody to come in and build more housing. There's no competition to drive rents down or anything like that. So it's nice when you build an income restricted development because you're going to directly impact the people who live in that building. And it's great for them, but it has no broader impact. So my hope is, and this is my personal hope, I'm not speaking for the committee or anything like that, is that as we develop more ways to incentivize people to come build in Polk County, that we do kind of lean towards market rate housing so we can bring pressures on everything down. Because like I said, I don't want to discount the fact that income-based developments serve a purpose and they can impact those people directly. But like if we want to have a broader long-term solution, it's the market rate stuff that it is.
Madam Chair, I think you got some good input there. The only really outlook and vision is for investors to get tax breaks. Right now, there's this big opportunity that McGregor Corporation wants to come and build on the old hospital site in Osceola. I read quite a few details. I went to the village board meeting, and those basic income would be $1,500 a month, like you said. It's not so much low income; it's that there's companies that want to be here, there's people that want to be here, and if the government can give investors a tax rate like they're willing to do, and there's an example of it in Polk County. But I went to some of the meetings and people are protesting, well, it's gonna take our parking and it's gonna be noisy. There's a church right across the street and we kill some of these things on a local level.
Not in my backyard.
They're not in my backyard.
It's a hubbub.
And people feel that way about elderly housing in general, not in my backyard.
And that happened in St. Croix Falls with the tiny house development. That's another solution that's more forward thinking about having a community of tiny houses where people have their own space, but they also have community support and a garden and they can keep an eye on each other and common space and
So maybe it's.
there was a lot of, but I don't know, it may be moving. But that got approved. It didn't get approved, but there was a lot of hubbub about like not my backyard, but I think that's another creative way that's different than making a huge development that you could actually make it quite affordable. And also deal with the loneliness issue, and do it in a way that's really accessible both for elders and for young ones.
Maybe it's an organization like we have right here at the table that somebody's got to counteract it. And maybe it's an organization like we have right here that has to show our need to step up. This opportunity has to happen. We have to all step forward and help make it happen. it's a grassroots thing that, really,
I have a comment too, but the sense of community and that rising up, opening up for affordable housing, bringing in businesses, that is really healthy and I think brings longer range, broader effects than just passing out checks to people, because now the money's gone. They're in the same boat. Some of them might be working, I hope, but I do think that's a way to go.
in Osceola's case, this is the third developer now that came up and stepped in. And, public, attitude really killed the first two, I'd say.
And some of the obstacles that we face in our area in general, we have to look at the reality of, there's a reason that we don't see, because one of the questions, I'll step back one more time. One of the questions that we've received at the EDC is, well, if this is such a need here, if we need housing, and there's such a shortage of housing and things like that, why aren't developers lining up to be here? And it's like, well, you throw a dart somewhere on the map of Polk County, you're not gonna hit the requirements that a developer is looking for as far as like distance from help, from medical facilities, schools, like any number of things that a developer is looking for to be like, I want to build there. The fact of the matter is that where we live, there's always somewhere that's generally a little bit further away from us. That's a more appealing prospect. So they're not lining up to build here. So it's up to us to say why they should build here. Because the alternative is kind of this stagnation where over time, say 10 years from now, we've still done nothing. And then we've kind of, without really noticing it year over year, lost workforce, lost businesses and things like that because of a housing issue. And again, I'm not saying that action right now is going to all of a sudden fix everything, but small steps are going to stem the bleeding and then get to a point where it becomes a positive, return on.
If we want a tax base.
Yeah, yep. And there's concerns from people who have been involved in the process so far about, loopholes from developers who can come in and kind of pull a switcheroo on you and say like, well, now we're nonprofit, now you don't get taxes from us and things like that. So we do have to be cognizant of what happens with certain models from developers and things like that. But at the end of the day, also the tax income is kind of secondary to what we're talking about when it's a housing issue. The tax income is kind of icing on the cake. And the actual housing issue and solving that and getting people in the county working, housed, and having that effect, the domino effect that goes down, that's the important part. The tax income is secondary, great. But we do have to be careful with it, not just to be like, well, we don't care if we can tax it.
Polk County, Economic Development has been running some comments in the Osceola Sun about how they're backing this project. Our county is behind it. I think it's going to take care of like 350 people or something.
And that's that Osceola project is an example of they wouldn't be here if it wasn't for the community stepping up and saying, here's how we are also going to incentivize the builder to come here. Because the builder didn't just come here and say, we want to build in Osceola and we want to use that building. The village or whoever it was, or the city needed to step in and say, here's the concessions that we'll make for you guys in order to come here.
Oh,
and
exactly.
do this
They
project.
can't do it without them.
Right, because if you look at the other projects that builder does, they're in communities much larger than ours. Because it just makes business sense for them to build elsewhere, so I know we're going long into this.
I think the answer is yes, we like your proposal. Thank you.
Sorry.
Thank you, Tanya.
Tanya, did you ask 211 if they booked that on calls that come in from places?
I will. If that doesn't know.
211 United Way, they're like our hub for referring people for all sorts of resources, but I wonder if they collect data as well.
Bill asked if economic development was involved, and then I just kind of blacked out.
No, it's
Sorry.
good. Very good.
I'm gonna bring that up again, right? Okay, great answer. I mean, I appreciate that. I appreciate Vince's input too on that, because I think it's important that it's tied together here with a lot of this.
It's all this multiplier thing. that's really
Absolutely.
important. This is the community that really can understand that. There's nobody else really working on it. Okay, the HUD director.
Did I say that out loud?
Okay, number 11. Update regarding public transportation study needs assessment. Thank you, Tim, for patiently waiting.
Thanks for inviting me. Handouts here, in around.
It's the thing I saw the other day,
Yes.
and I don't need.
Oh, while I'm passing these out, I've completed the first round of surveying. That's what you see in front of you. It's not a statistically valid survey, just want to make that clear. It's just a general public sentiment, if you like. Want to briefly touch on at least a few of the key points. Forget that this is a video of many. Maybe 5. So, my apologies. We had what I can determine, really good response rate. We had almost 600 responses, both in paper and online surveys. There was a big push, and I thank all those that did a lot of outreach for this, including Tanya and her department. Laura Neve and ADRC did a big push as well. Claire was helpful in helping design and with the survey information out there to get these responses. We had a good response at the fair from the booth that CSD had there, and they were delivered to see some of the housing developments, Meals on Wheels, those kinds of places were given this. So we kind of targeted a little bit more than maybe your average survey, the population that might be using this to get their feedback. So I think that's good. We also had an outreach to the recovery group here in Polk County, Polk United, met with them back in late July, and we now have a new member on our advisory board based on that. So that's really good. They were super excited about this project and the potential, all the needs that folks that are in recovery have to get to meetings and get transportation. A lot of times we don't have driver's licenses due to substance abuse and that kind of stuff. So there's a big need that you mentioned that. So I'm glad to have them on board. All right, just real quick, going through the survey. Yeah, we almost had 600 responses, which I think is fantastic for this. Again, it's a targeted group, so you might not be surprised that about 80% or a little over 80% said you need public transportation here in the county. For those that said we do need it, shopping and medical services were kind of the main crux of what they would use public transportation for. And tying into that, obviously the biggest hub for shopping and sometimes even medical stuff is St. Croix Falls. So that was a big target for people saying this is a place that we need the service to go. Obviously, we have spread out population here, which makes transit a challenge. It's one of the things that we'll have to consider strongly going forward. And as you look at the survey, we asked kind of which type of service you would like to see more, you know, whether it's a fixed route one where you have to get to, like say a bus stop to utilize the transit service, or if you need door-to-door service. That's pretty well split, as you might imagine. Some people have severe mobility issues and can't get to those stops, but also they need fixed route and knows when it's going to be on time, going to go to specific spots at different times, different days. Real juxtaposition, I guess, you know, have those two competing interests. It's tough to parse those out because the needs are there in both regards.
It's kind of a funny way to present 213 to 183.
Yeah, it looks really skewed that way, but it's not a big difference in terms of numbers. So yeah, that graph might be a little misleading. Let's see here. Now, the most important feature for transit service, as you might guess, is how much does it cost? That's going to be a huge determining factor. We got some generic numbers about, you know, for a 20-mile round trip, how much do you expect to pay?
by far and away, the cheapest amount available was there, so, you know, they were expected, it would either be really inexpensive or even. So, how you pay for that will be part of the ongoing, investigation of this process, is to figure out what our funding mechanisms, if a process like this or a project like this was to move forward, what would that entail? That's why it's nice to have some company and business representation on our advisory group too, to see what their needs are and see if, you know, whether it's the medical community or the manufacturing community or any small businesses, if it's really an issue about getting employees to work, how we might be able to contribute as well. Beyond the survey, I just want to make one quick point. You know, we have a variety of different transportation services already in place, whether it's ADRC, Intercounty Faith Givers, VAO, there's a bunch of different ones. And one of the ideas that came up is to have all of those get together as a group and see what services do they really cover. So we can identify truly what those gaps in service are. So that maybe we can target this program or any possible transit program in the county to those unmet needs. I guess lastly, 85% of the response for 35 plus. In fact, 45, I think 40% were over 65. So that might represent why you might see like the needs for door-to-door service. You know, a lot of our respondents were in retirement. So as well with our previous conversation here about housing needs, and if we have a fixed point where we have a larger development or, you know, apartments and that kind of stuff, it makes transit a little easier because you have a spot where you can go to, but it would be close by where you have a lot of people that might need the we met last week, as Barb knows, for our advisory group, that's staff plus the businesses and hospitals and all the other interest groups. Reviewed the survey. We had some question and answer stuff, and we went over some of our draft goals and objectives. And that's the other handout that you have in front of you, is just to kind of get the background of the project here, and then the draft goals and objectives. They're not updated based on the feedback we gave them, regional planning as of last week, but that stuff will be coming out soon. Any questions?
Yeah, quick question. Question 16, what is your home zip code? It looks like Osceola and St. Croix Falls were big getters. What's 54001? Okay. Page 10, column 2.
Will they pull my boat?
Right, yeah.
Some people can be so funny.
I saw that one too.
Yeah. That's awesome.
Thank you. This is good stuff right here.
Yeah, it really is. Thank you for your work on that, Tim.
Sure.
Yeah, and the regional planning folks were really impressed with the numbers, the response. It was maybe twice what he was maybe expecting. So kudos to all the that went into.
It might have been bribery.
Yeah.
Maybe. Some prizes. I just have a question on this. It said that 80%, 79% of them have access to a personal vehicle. And 40%. So probably you guys have already found out just getting drivers rather than, you know, getting a just going and driving their own vehicle.
Correct.
Maybe they just don't have driving.
That's part of it. Some of it is those folks even that have their own means of transportation. We saw quite a bit in this survey that they just see the need or the support that's out there, so they might not be connecting their own personal ability to utilize transit or need for transit, but they recognize the broader need for it.
Oh, I see. They might be just.
Yeah.
Just a kind of anecdotal, because I was one of the, Anya and I was there, and a lot of the feedback was, well, do I answer this as what I think right now? Or where I might be in 5, 10, and 15 years? Because a lot of the people are like, well, I don't have need for this right now, but in 10 years I might. So it was interesting, you know, just the people were thinking forward as well, as what we might need.
I'm also impressed by question 14. If you're employed outside the home, how far do you travel to work? And I don't know how many people that all, there are people driving up to 30 miles.
We have a significant commuting population, especially out migration population on a daily basis that goes outside of the county. For work.
Yeah, and it's a bus that goes, I know as far as Turtle Lake and Stockton, you know, all the way to. St. Croix County has just an awesome transportation system. Stockton all the way from, starts in Eau Claire, goes all, and you can go to just about anything in there. My question would be, Tim, in all of this, did you have any correspondence with any institutes in Minnesota at all? I imagine Dr. Loggins he would know the same thing. But every time I go to Dick's Market in Osceola, every time there's at least half of the license from Minnesota. Osceola has a medical center, has a satellite over there. And I imagine huge of your business in your life has been the interaction with Taylor Falls and all really long ways. There's really nothing between Osceola and Forest Lake. And those people we have a school bus that goes in Minnesota. Those people are impressive. They're so dedicated to our facility.
Yeah, I know there's quite a few people that cross the river going this way to utilize the services in both St. Croix Falls and Osceola.
And I would offer too that there were a number of folks who asked us at the fairs, well, but I live in Minnesota. And it's like, well, we still want your perspective. You know?
Yeah, the outreach, John, didn't specifically target anybody in Minnesota that I'm aware of.
And my point is that that factor really has a huge impact on what we have here, much more than what we see on paper.
Anything else?
Just to play devil's advocate on one thing, I laughed when I first read it. Somebody said,
Wait,
maybe try to get a grocery store in Balsam Lake, worrying about public transit. I know that's meant to be snark, but there also is something to say, without saying that we don't need public transit, there is something to say about a long-term effort. And I don't know if it's feasible or not, but there is something to say about like a long-term focus of the county to get nostalgic, get back to the days of having super value in Balsam Lake and having the grocery store in Milltown, getting to a place where we can sustain businesses within the community like that again. Because look at one of the, what's the most common destination on here? Walmart. And I'm not saying I know exactly how to do it, but if we had a grocery store, you know, in communities again and things like that, and just creating an environment where communities can sustain local businesses and not have to rely on public transportation to go to St. Croix Falls to go to Walmart, that could be a good long-term vision. Again, not detracting from this at all. Just saying like long-term focusing on businesses and local communities could be a great thing. So people don't have to say, I'd love for you to bring me 12, 15, 20 miles this way. They can just hop in it.
Good vision, point.
Yeah, agree. Anything else? Done? Thanks, Tim.
Yeah, I agree. I know it's much easier. It's not just take care of it.
Okay, Tom.
It's up. Yeah.
Wait. Everybody knows what's in the meeting?
Yeah. Yeah. I have some-
Fantastic. Oh, hold on a second.
Okay.
I
Should I
know
go
that
back
this
up?
was public. You can keep passing up. I just want to say that if, for those of you that don't know, Tim is taking an awesome job with that council. Our lost their game.
Yeah.
And my exact response. And that was my response too, but I think Tim's been an asset for the county. How many years have you worked here? 14 years, oh my God. Thank
Kid
you.
from Chicago.
That's right. Black Ops stuff to do with them.
But I've appreciated your work, your digging into issues, stuff you've helped us with at PTAG, the field work, and all this. And I was very sad when I saw you were leaving, but thank
You ain't
you.
gonna move,
Thank
are
you
you?
so much.
I appreciate that. Thank
Yeah,
you.
no, you've been a huge asset.
Still see you in Polk.
That's right. Yeah, we'll still see you at the Braves games for sure. Yeah, I'm not going anywhere.
Okay, thank you.
Yeah, thank
We
you.
can still tap your resource, Tim.
That's right. You know where to find me.
Yeah, right. How many committees can we put you on?
Maybe.
Please run.
Yeah, right. I appreciate that. Thank you.
Thank you. Okay. Tanya? Oh, no. Don. Thank
Some
you,
of you
Don.
have seen me before. Doing something remarkably similar about where we are with the budget. But for those who haven't seen a presentation like this, I'm Don Wortham. I'm the relatively new general government director for the county. I think we're up to day 40. And I'm here I'm here just to give you sort of a 30,000 foot view on the budget and just a little detail about requests that are coming in from departments that are related to HHS. So I'll try to keep this relatively brief. This is just an overview of where we are with the budget process. We have an annual budget and the budget will be in force as of January 1st of 2023. And we're currently with this red dot presenting a budget overview to committees. The green dots are board meetings, green or aquamarine. Vince and I will present at the 20th of this month, a broader overview where all the pieces that committees have heard, but still at about 30,000 feet will be presented. We'll go back working with committees in October. You'll drill down, get more specifics. We will have done some squeezing by then, but you'll have some things to decide or recommend. And then on the 18th of October, the full board will consider the complete budget. It's published in the paper on the 25th. There's a public hearing and the final approval by statute would be the 11th, the 15th of November. So any questions about the process here? We will go on. Just a few words on budgeting principles. So really important, we want to draw the levy last. So when we've got extramural funding like Tanya's group is so great at getting, we're going to try to maximize that and go after the levy last. Our spending, we wanted to reflect board priorities. If you've been on the board for a while, you remember maybe 2.5 years ago, we did a refresh of the board's priorities, and we're likely going to do that again in the spring. But we want to keep the budget focused on board priorities. And there's a couple that are related to what you do here. We've got the well, I guess 3 of the 4, if not all 4. Crime reduction, crime is an everybody thing. Substance abuse directly connects into this committee. The expansion of broadband, good things happen to the community when broadband's expanded, and then keeping people active with a focus on recreation, parks and trails. Those were the 4 top priorities when we last did that work. Departments each year look at what they've been doing operationally. They think forward about what they need to do in the future, and they develop plans called additional funding request plans. They submit those to administration to review. They're thinking a lot about what they don't no longer need to do, what they need to do in the future, and how to afford that. So my group, General Government and Finance, works with them on that. We develop a 5-year capital plan. Just yesterday, we revealed, sort of opened the kimono and showed the draft capital plan to General Government Committee. We've got about $14 million worth of capital requests this year.
Wow.
And about 3.7, maybe a little bit more of those requests are currently unfunded. So we're imagining having to tighten things up, and that's one of the things we do from mid-September to mid-October.
Now, how many do we normally have? 14 high?
It's a little high, yeah. Last year, we funded about 6 million capital requests. So we still got some COVID money that we're working with. And one of the things you'll see on another slide is the COVID money, we're not imagining more coming in. So, okay, we'll go to the next slide. A big chunk of our budget, about $33 million, is people. Well, how do we deal with that? Well, each year we look at whether we need to do a cost of living increase. And I assume most of the folks in the room have felt some inflationary pressure over the last year or so. When we polled our counties in Wisconsin, we see a pretty wide range in terms of what county governments are trying to do about cost of living increases from 2 up to about 7. The counties around us are in that 3 to 4% range right now. Last year, employees received a 2.9% cost of living increase. Our working range for our models right now is between 3 and 4%. There's a merit component to what we do for employees. That's been 2%. We're likely to keep it at 2% this year. And this is a little complicated to try to explain in a very brief amount of time, but last year the board directed general government to consider how to implement a merit-based pay program, perhaps with some bonuses. To be able to do that, we had to expand the reach of our merit plan so that all employees, or the vast majority of employees, would be covered. Previously, about 40 of our employees had been left out of the merit plan because their pay was beyond market rate. So what we've done for 2023 is we're projecting that all employees would be eligible for a merit bonus. That hasn't been the case in the past. A big component of expense for employees or employee-related expense is healthcare. We all know what's going on with healthcare prices. We've been great here in the county about not spending any more money than we have to. We're self-insured. Our actuaries are telling us we're likely to spend about $4.6 million directly on healthcare next year. That's actually not an increase over 2022. So we're super proud about that. Our goal is and has been and is to keep employee premiums as flat as we can. Now we have about $7.2 million in a health fund that allows us to modulate what employees pay and what departments pay. We've got a plan to draw that down over time. Our accountants are telling us we need to do it. So we have some flexibility with our health fund in terms of moderating employee and department expense with respect to health. We'll go to the next slide. Non-employee operating expense. So that's money spent on mileage. It's spent on services. We asked departments to first look at a modest increase of 1.5% over 2022. Just to be prudent, we're also modeling flat and even a decrease in operating expense. We talked a little bit about capital already. We've got that $14+ million worth of capital requests. By the way, capital is any item to us. Capital is any item that's over $5,000, and we can depreciate it. I've got a couple of examples. Most of you are probably aware of this, but capital is not necessarily tangible. So software, as an example, is always somewhat surprising to people that something that has no physical instance is capital, but it is. Okay, we'll go to the next slide. So this is kind of a concept slide. When you're doing budgeting, and maybe you do the same in your households or your businesses, you want to think about what's, kind of baked in and inflexible versus what's flexible. We don't determine how much our levy is. The state does that for us, essentially. We have to do the math for the state, but there's certain rules about how that's done. And we will get a levy allocation. We could decide not to take all the levy. In the last few years, the county has decided not to take all the levy. So you can leave some on the table, but you can't get more. If you want to build buildings and bond for that, then your levy can be increased, but there seems to be a little appetite for that. And all the money that you raise just goes to pay for the buildings. We don't have any control over sales tax. We just collect it, or the state collects it and sends it back to us. So those are relatively inflexible. Tanya's group does a great job of applying for grants. We have some flexibility. We can decide to apply for a grant or not to apply for it. Of course, we can't decide whether we get it or On the flexibility scale, we've got a savings account here in the county. And if you were at the September board meeting, you heard our accountant, Jonathan, sure would say the county's got $28 million in the savings account. We don't have $28 million we can spend. Half of that we have to keep parked for a real emergency, about 14 million. And then when you take, when you label up all the other things we've already promised to do with that 28 million, you're down to about 6. So the board has about $6 million of money that you could decide to do something with. Of course, once you decide to do something with it, you don't have the 6 million anymore. So, you know, being prudent is good. I mentioned the health fund a second ago. That's something that we can also spend against. It's once it's gone, it's gone. And we can only use it for health related. Organizations like the county can borrow money. We can bond. It's a tool. We're just talking about the range of tools here. We want to stay below our debt service limit, which is about $2.5 million. That's how much we would pay in debt service or interest payments each year. We have about $1.6 million of capacity left before we'd hit that limit. So we could borrow that 1.6 and not exceed our own threshold for what we want to spend on basically interest payments. Any questions about this?
We ain't gonna have to do that with the overrun, are we?
Let me make sure I understand your question.
And that flex money there,
Right.
our overrun on our project, are we gonna use any of it for that, or wouldn't that apply?
Oh, that's exactly, the general fund would be used if, you know, I think Mo's talking about the general government center project coming in about $400,000 over budget. That would come out of the general fund.
That was my
Yes.
question. Thank you.
All right, next slide. Getting close to the finish line here. Okay. We already talked about the levy and relative inflexibility. We're going to collect about $24 million with the levy on a $68 million budget. We just got the state forum, so later today, maybe even tomorrow, later today, tomorrow, and this week, we'll know exactly what our levy amount is, but we don't know it right now. I mentioned sales tax being an inflexible thing. We can't control it, but we have been bringing in more than we budgeted for. As an example, in 2021, we budgeted 3.6 million, but we brought in about 4.6 million. 21 was a very interesting year. Lots of money floating around, people using it to buy things. Sales tax revenues were high. We're imagining that that's going to moderate over time. What we're hearing from our consultants is that we should be pretty confident budgeting between $4.25 million and $4.6 million for sales tax revenue. And then we've got folks that are applying for grants all the time, but we don't see a situation where the federal government or the state is going to be pushing a lot of money across the table to us this year. Okay, next slide. So what are we thinking about doing with our resources? And folks from community services, or if there's public health people, if there's any discussion about these items, I'd welcome it. But right now we've got some additional personnel related funding requests, a little less than $20,000 coming from community service. There's a request for a DCF manager and some really modest capital requests to finish off some of the government center stuff that wasn't in the budget to begin with. There's a possibility that some of this will be funded internally and not may not end up being additional funding. We may be able to find it within the organization. Public health, trying to get that emergency operation, not the mobile center. This is an area within the government center for emergency operations. We think we're going to need about another 100,000 to get that all fixed up. Next slide. Then we've got some related agencies of pretty modest requests from ADRC, very modest. DAM is doing a lot of things differently, or planning to do a lot of things differently this year on the personnel side. They're going to try to avoid using traveling nurses and other professionals any more than they've got to, and convert some folks over to full-time. So they don't have a lot of requests other than a few for capital. And then the vets are asking for something to get their office a little more livable, and we may even be able to get that done this year, so they don't have additional requests. So not a lot for you to consider, we're imagining in October. There may be some new information coming in, but I think you'll be looking at not too much when we're here next time.
We didn't put that additional funding for that.
We don't have that in there right now. Yeah.
Can I ask a quick question, Don? I'm sorry.
Yes.
Check this on the way back to slide 4, which is
Sure.
the forecasted employee expenses piece.
Yeah.
I understand the cost of living, and then I understand our healthcare. We're always watching that, and I know the auditor had wanted to push that down or not.
Right.
Did you say the merit piece was that, you might have to repeat exactly what.
Yeah, so we were talking about this bullet here, we're assessing and expanding merits. So up to this point, you would qualify for a merit increase if you were paid between the minimum and what we call market. But if you were at market up to market +5, which is our maximum that we pay, you weren't eligible for a merit increase. So I think that's about 40 people in the organization, about 10. Those folks would not be eligible for the merit-based pay system that you didn't suggest as part of the resolution that you asked the time board to move forward. So to have a merit-based system that excluded people seemed to be perhaps unfair. Now, I think you could also argue that it's possible the merit-based system, if it was progressive and not regressive, would reward higher paid employees more than lower paid employees. The one thing we're looking at is merit systems that aren't uniform. In other words, like property tax, income tax, and property tax are different in terms of being progressive or regressive, right? So we could look at an employee compensation plan that we can look at it that awards a higher percentage to lower paid employees, a lower percentage to higher paid employees. We can look at that, but we didn't want to not allow the entire employee base possibility of some sort of merit. That was really long-winded. Did it make any sense?
Yes, I think so. Okay. So my question was, or I'm not sure, I have a couple, I'm not sure, a question. So the board passed this at some point? Was that?
Predates me. It was last year. We can find out the resolution number and the language for you.
Yeah, maybe that would be helpful.
It's a budget resolution. Wages are always in the budget.
Oh, it's in the budget resolution. Okay.
No, I think she's asking about looking at a merit.
The merit system.
And I don't know that it was, I'd have to look. I don't think there was a resolution. I think it was a discussion with the former general government committee. Right, there was an issue with looking at longevity pay, which is paid out at the beginning of December. And it was like $75 if you've been here so many years and $100 if you've been here.
The only resolution we had was the performance-based pay.
Yeah.
Was the beginning of.
Yeah.
So that's the one.
So there was a resolution.
There is a resolution for performance.
Is that the same as what you're calling?
Yes,
market?
yes.
Okay, so how many, so we have 40 people that are at market and not potentially available to get this.
Up until yesterday, yeah.
And then how many people do we have below market that
Well,
we're trying to get to?
you know, it'd be the,
We have a funding request.
yeah,
Didn't make.
it'd be 411 minus 37, or whatever the math is.
So it's like 300 people.
Right, it excludes Golden Age Banner because their system is different because they're an enterprise fund. Excludes the WPPA, so the deputies, because they have the collective bargaining agreement. And so whatever
those out.
number that is excluding and then taking away the approximately 40. But a lot of this is remnants of Act 10. So when Scott Walker signed the law getting rid of unions except for police. So with that, there are some longer term employees that have positions that are paid much beyond what the grade max is right now. And that's because they were grandfathered in from Act 10, but newer employees with the current wage grid. So the newer employees, generally speaking, except for, professional levels and that sort of thing, but your newer entry-level positions or frontline positions, those are the ones that are kind of sitting at the lower end, starting at the minimum and working their way up.
So I think that's the root of my question. My concern is how do we get those people merited and raised up? If we have a finite amount of money,
Yeah.
and those are our future people.
Right.
I'm sure that the people who are at market and plus are people that are gonna retire in the next 5, maybe 10 years. I'm not sure. I don't know what the
Well,
numbers are.
you do
But
something like, offer a greater percentage to the lower end of the wage scale. And then I'm just gonna use some numbers, but let's say you had a total of 2% to allocate, you could allocate, making this up, 1.5% of that 2% to the lower end, lower range of the wage scale, and 0.5% to the upper. So you don't have to make it uniform. And you could address what you're describing with a model like that.
Is that what we're doing here in these? in
We
these
haven't done it,
buildings?
we haven't done it yet at all. We
Oh,
haven't
okay.
implemented it. Yeah, we've just been uniform 2% so far. Yeah,
So coming from the civilian world is where we don't do COLA. You just get a raise or a bonus.
Right.
Which is a raise and which is a bonus?
yeah, well,
Kind
actually,
of
the
equivalent.
cost of living would be, we're keeping your salary up with market.
Right, good. So
And then
that.
you've done a great job and we want to invest in you. That would be merit.
Okay, so the cost of a living adjustment being an adjustment, wouldn't you think that you would want to adjust the 3 to 4% to bring people up to market in that category? Because I mean, so if everybody gets 4%, consistently people that are above market are going to be above market. Consistent. You're never going to bring up, you're never going to do this kind of thing.
This has been
It's always
noted
going
by
to go
your,
like this.
Our struggle over the last years has always been exactly what you're saying, because we have people who come in at the minimum range, at the low end. They takes them 8 years to get to market, 10 years to get to the max. So to stick around for a really long time to get to that where we think rest of the market is paying. If they came in at midpoint, we could cut that down 4 years to market, 6 years to max. We had submitted a new funding request that didn't make Don's presentation, but it's out there. And Vince knows that we are talking about this today. I talked to him this morning about it. We wanted to provide a solution for our division because it is such an issue in our division that we have people, 53% of our staff are at midpoint, 77.9% are at market.
No,
Below market. So 78% of our staff are at that minimum.
It is important to note that our term market is artificial. So it's not like we've looked into the market and we know this type of position earns X amount of dollars. We just labeled a certain spot on our grid as market. It's minimum, midpoint, market, market plus 5. That's our grid.
Could I address that? So the last time a wage study that would give us market information was 5 years ago. So in our department, we are requesting a wage study for 2023.
Oh, yeah.
And so with a wage study, we would be able to see if our market is actually market, which it probably hasn't been in many categories. And we can also detect, whether we're substantially underpaying a fraction of our workforce. We get that information in, then we can make adjustments to the merit system. Denise, I haven't heard anybody suggest up until this point that we adjust COLA, but the board is the policy setting body for the county. So all ideas should be considered.
I think Denise's, your point, I think you had a good, this makes sense to me. So
Yeah.
we're constantly doing this with our pay scale, we're not doing this.
So
some way-
explain to us,
This is what you want to do.
That's what I mean.
Point of order, madam, I think we're going way into policies more than we are with the budget that we're here to
well,
address.
it's a new funding request.
I'm just gonna explain this.
So what was always explained to us back when Andrea Jarrett was the human resources director is that market plus 5, which was really market plus 2%, right? They always went with the 2%.
Well, if I could, it was just 5% over the market. So if market was $100,000, it would mean that we would not pay over $105,000. The 5% has nothing to do with the 2% merit. It's just that we're getting deep in here. It's
So anyway,
just
so
the width.
They
of
always
the-
explained that it was meant to close the gap, was what it was meant to do. It seems like there's 2 different issues at hand here. However, we still struggle with the fact that we have people at the bottom who will never get caught up. That's what we want to be noted here, is that it will take you 10 years to get to a maximum at that grid system. So something does need to be done. We had offered 2 solutions. One was a fixed part of the problem solution for how much? 175?
I didn't even put that one on there.
175,000 to really fix the problem in our division would cost us 350,000 to get people to at least midpoint. And get them on an expedited to get them up to where people doing the same jobs are doing.
This is not a new problem. Minimum wage went up mandatory $15 in a lot of companies. They had new people coming in at $15 an hour and you know, people been working for 5 years and at $13. So it's more, not a new problem. And there are a couple solutions.
Right, so with a finite amount of money, so we have to keep that in mind too, so we have to figure things out. And I just want to explain the other funding requests that we have. The personnel related funding for 17K is just to get some AP people at the equivalent within our division. And a lead worker, the additional DCF manager, that has to come through budget because it's a new position. So the county board approves those new positions. We have the allocation to be able to fund it. So we're not asking for another $100,000. It's within our already given allocation of levy and grants and all that. The roll down is for the lobby. So just to be able to secure our front desk. Keep it safe. There will be an open area for the public to use when you come for county board meetings. Eventually, you'll be able to walk in there and you can take a seat, you can use the bathroom, whatever, but we want to be able to lock down that front desk so computers don't get wrecked and that kind of stuff. And the capital expense for the emergency ops center, we are moving that downstairs because in the remodel project, inadvertently, our emergency operations center is being dismantled. So we need one, we have the space for one, and we have the funding. So that is not another additional amount of money. We have COVID money that we can take for through our public health budget. So we have COVID ARPA money that is not factored into it. So it's fully funded.
And it's not fun, and it's not through public safety. It's through-
Correct, it's through us. Just through us. This is the room where we set up incident command, not the mobile center.
Only one we didn't have funding for was the 35,000 roll down. The rest of them, we do have funding available in our current budgets.
And if we could find a way to fit it into COVID, we sure would, but we just can't make it in there.
Just one quick question on when you say merit-based, I take it that there's a criteria list of what is merit-based pay? On how, on how that performance, and then somebody has to make that decision whether you are meritorious or not in your service to the county. Okay, then the next thing that goes with that is, I take it there's a determination as to when you give out merit pay, what is the job that you're doing and what is the merit based on? And I'm looking at from the standpoint of me sitting in an office compared to a driver from the highway department outside working next to some very difficult equipment that might kill me. So someplace in there, you always do this type of thing. And it never gets to be here because of the difference in your job description. So how do you address that?
Well, and it hasn't been fully designed yet, but one idea would be that at the department level, you get 50%, and it gets allocated. Remember, we had a little bit more complicated discussion. You might have bigger pool of money for folks lower in the range and a smaller pool for people higher in the range, or you could have the same pool for everybody. But if it's merit-based, then the manager has to say, I'm going to spend a little bit more on Sally and a little bit less on Fred. And ideally, they have a set of objective criteria that fits the job, plus also fits other characteristics of being a great employee. And they have to kind of, being a manager is tough, right? You've got to make these evaluations as objectively as possible, as defensively as possible. And we've got a lot to learn to get there.
Previous practice was that if you got your merit, which I say was, it's an adjustment to close that gap.
Right.
So if you were under market, you got the merit adjustment. That was the. If your supervisor assessed that you got a raise, you got that merit as long as you were under that.
In the past, we have actually withheld what we call COLA. Right? If somebody is not up to snuff. So there's been a mix of the terms have been sort of not used appropriately as far as what they were. So this is, the goal is with a new HR director, with Don, putting their minds together and coming up with this program so that we can address all of the issues that we're talking about. Having said that, this is sort of a budget presentation. We're getting into minutia that is really not on the agenda. And so I'm just going to ask that you give it back to Don to kind of finish up that part and then move on. But these are great discussions, great questions.
Right.
I just want to comment one thing. I will tell you that from a public perspective, when you work for the public, they don't like the word merit. And unfortunately, there's a lot of merit that go with public employees, and they deserve every part of that. And I would just say that from a historical standpoint, because we did that with the Unity School District way back when. We looked at everybody that worked for the Unity School District, from bus drivers, custodians, et cetera, all the way up to professional staff. And we put them on a merit system, and it worked.
You sound like you're going to be hired as a consultant, Bill.
Yeah. I hope not. But I say that because you don't see that very often in the public sector. And I applaud you for doing that here for the county employees.
Well, I would accept the thanks, although the supervisors are the ones that put us on this path with this.
Right,
resolution back in
but
January.
I'm just saying, just for the discussion of it, and I hope the county board would take that seriously and say, yes, this is a very plausible, real thing that you should do. It's done all the time in the private sector. Public employees don't get that. You're working just as tough as anybody else. So thanks, Malia, for putting me on.
It sounds like there's a little bit of work to do though, doesn't it though, with making it a merit system and not an expectation?
An adjustment.
Yeah.
And you have to be very careful with preferential treatment.
Oh, yeah, they have.
And that's tough.
Have goals that are rolled down, that are defined.
And your
that
job
are
description has got to be all the way
And
down.
measured,
Yeah,
yeah.
absolutely. Thanks, Don.
There are no more questions? Any question?
No, I was just saying, thank you.
All right, thank you.
And Tanya, did this cover then what you wanted to tell us on 13? Preliminary year-end financial report?
Well, I think that is the audit, you know.
We are the two parts of the audit. And the first part has been complete. And Jonathan presented on it back in September. Jonathan from CLA. We are awaiting the compliance audit. It finished up September 30th. That's the audit that tells us, hey, you should consider, finance team, putting the credit on the left and the debit on the right, or whatever they're going to tell us. So we're not doing quite right. And we'll have an opportunity to address any of those issues going into the next budget cycle. So September 30th, the audit will be all done, and in General Government Committee, we'll come back and talk about what the findings were and how we intend to address them.
We can table that until the next month.
I would think so.
This one. Okay.
Madam Chairman,
George, yes,
Don, I hope on my part that you put in your patent for the administrative position. Reason why I'm saying that is some of you people are new, and here a few years ago, we hired an administrator. And after about 4 months, he realized that the financial part was way over his head and he resigned. And with your experience, your knowledge, I just want to say, hope you put your hat in the ring for our.
Thank you, John. I would say, I also hope that Mr. Netherlands sticks around for a while. So, thank you, John. I appreciate that.
What I mean is, Mr. Roberts.
thank you.
Thank you.
Okay, so,
Numbers, man.
okay, we'll pick back up on Thursday next month if we need to, the financial report. Okay. Legislative agenda, event report, anything? Update on-
I don't right now. Next Sunday is our Wisconsin Counties Association annual meeting. We're attending that. Meeting starts at 1 o'clock on Sunday. It's not one of these days. 5 and then start on Monday morning, starting at 1 o'clock on Sunday. Have a full agenda, and we, I'm gonna be representing, I think, I know 5, resolutions for sure from Polk County.
Thank you. Thanks for going to that meeting, John.
Can I add something?
Yes.
I did send out an email to the committee members about the Wixar conference, December 1st and 2nd. So if you are interested or waiting for the agenda, so you can see what topics, I will get that out to you. They do encourage committees to participate, and it's a good learning experience for you guys to come. And we will haul you down there, we'll house you.
Yeah. If you're interested. Okay, yeah, keep noodling us on that.
Yeah, keep us.
Yeah,
posted.
that sounds.
Yeah. Okay, so subject matters for the next agenda. I think we'll pick back up on the housing piece and the homelessness piece. Anything else? Besides that, that'll be a bunch of presentations, right? Yeah.
I also remember Supervisor Ryan requesting a change in time.
Oh, yes.
If possible, to 8:30. So I don't know if that's something that needed to be on this agenda to make that, we need to do motiony things about that, or if we can just say, is that a possibility?
Can we just make the change? Okay. Anybody have objections to an 8:30 meeting?
I would like to say 9 o'clock.
9 o'clock?
I think going from 10 o'clock to 8:30.
Okay, 9 o'clock,
Earlier the better for me.
6:30?
So I think like when you're 8:30 is just the earliest you can go, because I think that's county start time.
For staff.
Yeah.
I would suggest 9 o'clock.
Okay.
We started.
Oh, yeah.
Actually,
yeah.
start at 7:30.
Then we can pass them there as well.
Okay, yeah, right, 9 o'clock then, next month?
But are you moving forward with 9 o'clock every time or just this next?
Yeah, no, this would be a constant change. Is that okay?
So change it till we change it again.
So we're changing our meeting.
Would 8:30 be a problem, John? Is it just too early?
But it doesn't affect me, but I think it does affect the county staff and different things. But most of our meetings do start at 9 o'clock. I don't know.
Well, we have 3 meetings now that's starting at 8:30. We have
8:30
agenda.
is kind of a go-to right now.
Yeah, everybody's doing 8:30. And Tanya seems to be here at 7:30 as far as I can tell. Okay,
I'll make a motion to go to 8:30.
I'll second. Okay,
Okay, so moving forward. We'll change our
Moving forward,
calendar.
it's 8:30 until we change it, and then subject matter vote, all in favor?
Yeah, just, okay, just button it up.
All in favor to moving constant, regular time for this committee, 8:30? Discussion opposed? Okay, 8:30. Any other
Thank
item?
you.
Okay, any other items that we need for next month? Tanya will make it.
I move to adjourn.
Second, all in favor?
Pass that.
Barbara, thanks for remembering that.
Bye.